And thank you for allowing me to present my latest research. The title of the presentation today is Euthanasia of Animals, Suicidal Thoughts and Attitudes to Assisted Dying. And I'm a veterinarian by training, and I have my main experience from public administration, but I just finished my PhD on vets and mental health based on a Norwegian study. So the paper that I'm going to present for you today is part of a PhD project called the NORVET Project, or the NORVET Survey. And this is a nationwide survey, and that's one of the advantages of being a small profession. There are approximately 3,500 vets in Norway, and this was a nationwide survey which we distributed to all of them. And we had a 75% response rate, which is quite unusually high for this kind of old-fashioned pen and paper survey. And I hope it reflects that the veterinarians in Norway found this survey important to participate in. And we used multivariable analysis so we could control for several factors simultaneously and odds ratios to establish the associations. And 2 papers have been published so far. One on suicidal thoughts, both the prevalence of it and the associated factors with it, and also about help seeking for mental health problems and associated factors. And I would be happy to share them with you. They are open access, so please ask me if you can't find them. I would be happy to share them. And the last paper is on euthanasia of animals, suicidal thoughts, and attitudes to assisted dying in humans among veterinarians. And the NORVET study was a quantitative study, but we did have an open text field at the end of the survey where veterinarians could write comments to the survey, for example. And some did, but some also wrote comments that were more reflective. And I have 2 quotes describing how euthanasia of animals might impact attitudes to death more in general, and also the impact that it may have on mental health and suicidal thoughts. And the first quote is, "As a veterinarian, I can see that it's better for both the animal and owner when a suffering animal is euthanized. I was thinking the same about myself when suffering from a serious depression." And this quote kind of describes the veterinarian doing that evaluation of life quality versus euthanasia in a state of having a serious depression, him or herself. And the second quote is, "I haven't had suicidal thoughts, but if I was diagnosed with an agonizing, seriously disabling disease with a poor prognosis, I have a plan for suicide," which describes something kind of different from that before, a more rational view of suicide as a solution if they were to experience a seriously disabling disease. And together, these 2 quotes kind of describe some of the complexity with euthanasia of animals and the impact that it might have on both attitudes to death more in general and also on the suicide risk. So euthanasia of animals has been pulled forward as a veterinary-specific risk factor for suicide. But it's important to emphasize that suicide is always complex, and it's not only one factor that decides whether someone decides to take their life or not. And of course, the way that euthanasia of animals could impact on the suicide risk is also multifaceted. Just a disclosure, this paper isn't published yet. We have resubmitted the revision, so hopefully it will be out there soon. But please don't share any of the slides and the results with people outside this conference for now. So the first way that it could impact is, of course, the access to lethal means. And we know that self-poisoning is the most commonly used method for suicide, not only among veterinarians, but by health personnel or medical professionals more in general. Also, euthanasia of animals have been shown to be associated with moral stress and reduced job satisfaction. And many veterinarians report a lack of training, both in the euthanasia consultation and also the decision-making together with the animal owner. And it might also impact or be connected to a reduced fear of death and to altered attitudes to death in general, amongst others through a reduced fear of death. And lastly, palliative treatment is increasing in veterinary medicine more in general. And usually when you talk about knowledge of euthanasia, among physicians, it's usually associated with a restrictive attitude because you understand the complexity and the hard decision-making and the ethical aspects of it. So one of the aims of our study was actually to assess the overall general attitudes to assisted dying. So the research questions for this paper was to find out the overall attitudes to physician-assisted suicide and euthanasia in humans among veterinarians. And 2, if the main field of work was associated with positive attitudes to euthanasia in humans, and also if the frequency of euthanizing animals was connected to positive attitudes to euthanasia in humans. And lastly, if the frequency of animal euthanasia was associated with serious suicidal thoughts. And the main findings were that veterinarians had an overall attitude to assisted dying comparable to that of the general population, and not a particularly restrictive view as seen in physicians. And overall, women had more positive attitudes than men did. And looking at the frequency of animal euthanasia, we found that it was actually associated with a higher likelihood of having serious suicidal thoughts. And bear in mind that this is a cross-sectional study, so we don't know the causality, the possible causality mechanisms in our findings, but it's a finding that is worth exploring further. However, the frequency of euthanasia was not associated with having positive attitudes to euthanasia in humans. And I will give you kind of a context and a wrap-up after. So we had 2 outcome variables, 2 outcomes in this study. One was serious suicidal thoughts, and the other one was having positive attitudes to euthanasia in humans. And when we looked at the statistical model for having a positive attitude to euthanasia in humans, we found that companion animal practitioners were more likely to be positive to euthanasia in humans. And that's not maybe a very surprising finding, because they are having these discussions with the animal owners at a regular basis on when life quality is too low, and wanting to do the euthanasia of the animal. So they have experience in this decision making and these discussions. And also being of younger age and being single was associated with having positive attitudes to euthanasia in humans. And this is also known from studies from the general population and not probably very veterinary specific. So seen together from our findings, this might indicate that it's not the caseload of animal euthanasia itself that affects the attitudes. It's possibly more of a qualitative impact from the actual work and the experience and the knowledge. However, companion animal practitioners, as I said, are used to making these decisions. But the finding of an association between animal euthanasia and a higher likelihood of having serious suicidal thoughts is a quite novel finding, at least in a nationwide setting, which we should explore further. So to wrap up, veterinarians' attitudes towards assisted dying in humans did not differ from those of the general population. And 2, the frequency of animal euthanasia was associated with suicidal thoughts, but not with positive attitudes to euthanasia in humans. And lastly, companion animal practitioners had higher odds of having positive attitudes to euthanasia in humans, pointing to that it might be some qualitative part of the work actually impacting the views on death more in general and also on the suicide risk. And the thesis is also available online, free of charge, so I would be more than happy to share the link if anyone wants to dive further into the research further. And I'm on time. So this is my contact. Please add me or send me an email if you want to discuss anything further. Yeah, I'd be happy to answer any questions. Don't trip.
Thank you, that was really interesting. I went to BSAVA Summit a few years ago, and the keynote speaker was a human doctor who was involved in palliative and end-of-life care, and he gave a talk on kind of assisted dying and euthanasia in humans, which was very interesting. And I was interested to find out from him that the kind of general population has quite a different attitude to human clinicians on the sort of debate around assisted dying. Interestingly, a lot of people, myself included, obviously there were a lot of vets in the room, and we kind of put our hands up and spoke, that he cited the kind of stressors around being the person to perform that assisted dying procedure as a reason why human clinicians were very much more averse to changes in the law. And a lot of us kind of countered that slightly by saying that actually it's one of the kind of not best parts of our job, but it's one of the kind of, you know, biggest honours of our job is to be able to kind of walk an owner and a client through that process. That was 3.5, 4 years ago now. Do you know if the kind of viewpoints and the demographics are still very much the same in terms of the attitudes between vets and the general public versus kind of human clinicians, and whether that statistic kind of still stands around those differences? And do you think there is a want for further discussion between vets and human doctors around this kind of area? Because it really struck me that nobody had kind of come to talk to us as a profession who are involved in this all the time, and kind of involved us in that sort of debate. Do you think that there's a want to do that? Sorry, very waffly question.
No. And first, euthanasia procedures is the procedure you get the most flowers for from animal owners. So it's I definitely can relate to that. Attitudes to assisted dying among veterinarians hasn't been much studied. There's one study from Sweden and our study, but this is very sparsely studied among vets. And I think it's important because when you have a discussion on assisted dying, there are several tracks in that discussion which relates to different topics. One is the jurisdiction, because on one side you should protect the ones that are trying to take their own lives, maybe have forced admittance to psychiatric ward, for example. And on the other side, you should make someone, you know, take the decision to take their life due to circumstances in their life, disabilities, for example. And then you have the ethical discussions, and then you have the medical discussions, and then you have the existential and the more philosophical. So it's a really, really huge debate, and people are usually talking about different things. But I do think that veterinarians do have some valuable input to the discussion as a profession, because we are used to taking those making those decisions together with the animal owners. But I do understand the physicians that are restrictive because they actually have to do this because animals and humans are probably different, right? So it's the moral impact could be very different from the two professions. Did I answer your question? Yeah. Thank you.
I was interested in the help seeking.
Yeah.
And wondered if you had any. I've been told in the past that by farmers and vets that when they're seeing likes of sheep who don't show that they're ill or weak, and then they die, because showing weakness makes you very, very vulnerable in an animal setting. And I wondered if I've been told by people that influences their own thinking in terms of ability to show weakness and ask for help.
Yeah, in terms of our research from Norway, we have published one paper on help seeking, and we did actually find that production animal practitioners were less likely to seek help. We don't know the causes for that. That could be inconvenience, of course, because they are in rural areas. Maybe they don't have the time to take a day off to access that mental health services. So it's probably multifaceted. But I think we need more qualitative studies of the veterinary profession more in general, because quantitative research can give us numbers, but you don't know the real story behind the numbers. So it's important with more of the qualitative work. Yeah. Thank you.